I think this is a very special time and a very special place for our community, for our institution, as well as for all the children that we are entrusted to serve. And this is a lifetime that we're affecting, not just a life.
The opportunity before us to build one of the nation's leading epicenters of pediatric healthcare so that we can continue to live our mission, to improve the life of every child for generations to come. Growth projections make it clear to realize our mission in the future and to meet the needs of families right now, we must grow.
We have children that are leaving our community for specialized healthcare in other children's hospitals. They're going to Denver, Kansas City, Boston, Cincinnati. And why is that? Because we have gaps. Those gaps are going to be closed. This institution, just from a size perspective, will double in the next 10 years because of the kinds of services and programs we bring to bear.
This is what evolution looks like, a cutting-edge new addition, the Center for Children. A critical investment that will house Nebraska's only Level 4 neonatal intensive care unit, bringing it closer to our highly skilled pediatric specialists, diagnostic and surgical facilities. The center will also be home to an important companion program to our neonatal intensive care unit, the Fetal Care Center. For expectant moms carrying high-risk babies, it provides advanced diagnostic and delivery services, and for those fragile infants, immediate access to Children's team of specialists. Right now, Children's Pediatric Intensive Care Unit cares for the region's sickest, most critical children and teens. Projections indicate patient need will grow 40% by 2025. To accommodate, our expansion will house our Pediatric Intensive Care Unit and space for additional pediatric or neonatal intensive care capabilities. Another promise of our new building? Better outcomes and a better experience for young heart patients and their families. The new home for our Cardiac Care Center, offering the most specialized expertise and technology available, providing medically complex heart patients a lifetime of comprehensive care from infancy to adulthood. Patients like Caitlin Larson. As a baby, Caitlin received a heart transplant at Children's. Now an active toddler, her parents are counting on Children's to be there and to be the best as she grows up.
I feel that it was really a miracle that Children's had a transplant program in place for us. We completely depend on Children's being there for us now and in the future. The fact that they have a program that is going to allow her to go there for her life is so comforting for me. If they weren't there, I know that Caitlin wouldn't be here. And our lives wouldn't look like they do today.
Expansion will double Children's surgical services capacity. The need for more surgical space is acute. Surgery volumes increased by 13% last year alone. More specialties, more complex cases, and a larger regional reach are also driving demand. With 16 operating rooms, Children's will be ready. A larger, more modern emergency department is another exciting element of Children's growth. It will allow more patients to be seen more quickly. The Center for Children will strengthen the 4 pillars behind every great medical institution: clinical care, research, education, and advocacy. With the center, more robust programs and services will be possible. We'll be able to add and enhance programs of national prominence. The center also will support the advanced research needed to take pediatric care to the next level and attract the nation's best caregivers. Taking advantage of our current research strengths in pediatrics, we'll focus on 4 key areas of medicine with the goal of finding new cures and treatments, of improving outcomes, and ultimately, young lives. With eyes ever on the future, Children's has always valued the opportunity to educate the next generation of healthcare professionals as a proud teaching hospital. New facilities and cutting-edge programs will raise the bar on our ability to prepare future caregivers. We've always been a champion for children, but how will we step up to serve them in the years to come? Greater advocacy and community involvement are key. We will advance efforts to promote education, disease and injury prevention, and increase our influence on a broader scale, a dynamic force for good on behalf of the smallest and sickest among us. We are being called to be dreamers and doers, community champions and partners in translating vision to reality, allowing us to serve more and serve better.
It's much more than a building. It's about our community. It's our broader community in the heartland.
A vision that will forever transform Children's Hospital and Medical Center, funded by our own financial reserves and the generous benefactors who've put children first again and again, decade after decade. Changing lives together. It's what we do, and it's what we're calling our new capital campaign, a 5-year, $50 million effort that will help support this critically important campus expansion project and fuel children's research efforts. We have the momentum, the power, and the will, and together we will improve the overall health status of children on a larger scale, changing and saving more young lives, elevate our standing nationally and globally, and reach our full potential so future generations can reach theirs.
We want to be pushed. We are excited about pushing our skills, pushing our program, pushing our personnel to new limits, and I think we want to do that locally, regionally, nationally. And so what we want is to have the best program, not that we can be, but to have the best program, period. It's an investment in the future of our children, and it's creating a legacy of your own through the care of kids who are in need. And I can think of no greater challenge and no greater responsibility than to ensure the care of kids.